Seniors, please listen to this carefully, because what just changed in Washington could affect your prescriptions, your Social Security check, your nursing home care, your protection from scams, and even whether you can afford to stay in your own home. And here is the warning. Most seniors will hear the headline. Almost none of them will hear the details. That is dangerous, because some of these changes may happen automatically, but others may require you to apply. Some may require updated records. Some may involve enrollment windows. And if you miss the wrong deadline, you may lose money, benefits, or protections you were supposed to receive. I have seen that happen before. Not with this exact bill, but with older neighbors, retired teachers, church friends, and widows who thought the system would notify them clearly. It often does not. A letter gets missed. A form gets delayed. A phone call sounds confusing. And before you know it, someone who worked their whole life is left standing at a counter saying, "But nobody told me." That is why this matters. The Elder Care Protection Bill has now passed, and it is being described as one of the biggest senior-focused changes in years. If you are over 60, caring for an aging parent, already on Medicare, receiving Social Security, or trying to plan for retirement, this can touch your life directly. Your wallet, your health, your home, your safety, your future. But here's the part that should concern every older American. The news cycle moves fast. The headlines come and go. But the real help is always hidden in the details. And the details are where people either gain protection or lose it. So I want to walk through what this bill means in plain English. No political speech, no confusing language, no pretending every problem is solved overnight. Just what changed, why it matters, and what seniors need to watch closely now. Because knowledge may be the difference between receiving help and missing it completely. For decades, older Americans have been quietly fighting problems that should have been fixed long ago. Prescription prices that made no sense, Social Security checks that did not keep up with real senior expenses, nursing homes that looked polished in brochures but failed people behind closed doors, scammers stealing from widows, veterans, and retirees, families trying to keep parents safe at home without the money to make basic changes, and older people suffering in silence because mental health care felt too expensive, too complicated, or too shameful to ask for. These were not small inconveniences. These were everyday crises. They happened at kitchen tables, at pharmacy counters, in hospital rooms, in bank offices, in nursing home hallways, and for too long, too many seniors felt invisible. The Elder Care Protection Bill is meant to address many of those problems together. It touches health care, prescription costs, Social Security, nursing home oversight, fraud prevention, housing, mental health, and access to basic care. That is why you cannot just hear the title and move on. You need to understand what is inside, because the real impact is not in the name of the bill. It is in the parts that may affect your monthly budget, your medical care, and your independence. The first major change is prescription drug pricing reform. This is the part many seniors have been waiting for. For years, older Americans on Medicare have watched drug prices climb higher and higher. I have stood beside women at pharmacy counters who quietly asked the clerk to put one prescription back because they could not afford both. Nobody should have to do that, but it happens. A blood pressure medicine, a diabetes medication, a heart pill, something for arthritis, something for cholesterol. One refill after another, month after month. And when you live on a fixed income, one expensive medication can change the entire month. Groceries get smaller, heating bills get delayed, a dental visit gets postponed, a daughter gets asked for help, even when asking hurts. This bill expands drug pricing reforms by allowing Medicare to negotiate prices on more medications and move those savings forward faster. In plain language, Medicare can use its size and bargaining power to push back against some of the highest drug prices seniors face. That matters, because Medicare covers millions of older Americans. And when a program that large can negotiate, it can pressure prices in a way one individual senior never could. For someone spending $200, $300, or $500 a month on prescriptions, even a meaningful reduction can feel like breathing room. Not luxury, breathing room. It may mean filling every prescription instead of skipping one. It may mean keeping groceries in the house. It may mean not having to choose between medicine and the electric bill. The bill also places stronger limits on annual out-of-pocket prescription costs for Medicare beneficiaries. That means there is a ceiling on what some seniors may have to pay in a year for covered drugs. and that is not a small thing. Because the fear of unlimited medical costs can make retirement feel unstable. When you do not know how high your drug costs can go, you do not really know what your budget is. You are always waiting for the next price shock. This reform is meant to reduce that fear. But please hear this warning. Not every medication may be affected immediately. Not every price drops overnight. And not every senior will see the same savings at the same time. There may be schedules, covered drug lists, plan details, and notices you need to understand. So when you receive information from Medicare or your prescription drug plan, do not throw it aside because it looks boring. That boring envelope may be where the money is. The second major change involves Social Security, and this is where people get emotional. Rightfully so. Social Security is not a gift. It is not charity. It is a promise workers paid into for decades. Every paycheck, every year. You worked, you contributed. And when the working years ended, that check became the foundation of your retirement. For many seniors, it is not extra money. It is survival money. Rent, food, utilities, insurance, gas, medicine. But over time, many older Americans began feeling that Social Security increases did not match their real expenses. The yearly cost of living adjustment, often called COLA, is supposed to help benefits keep up with inflation. But here is the frustration seniors have been talking about for years. Older people do not spend money the same way younger workers do. A retired woman may not be buying new electronics or commuting every day, but she may be spending more on prescriptions, doctor visits, dental work, home heating, in-home care, transportation to appointments, and basic household needs. Those costs can rise fast, and if the inflation formula does not reflect what seniors actually buy, the increase in the check may look helpful on paper, but feel weak in real life. The Elder Care Protection Bill pushes for a better way to measure senior expenses. It focuses on making cost of living adjustments more connected to what older Americans actually face. That could mean more accurate increases over time. Maybe not a fortune, but when you live on a fixed income, even a few extra dollars each month matters. And over several years, those increases can add up. I remember sitting with a retired teacher once, going over her monthly bills. She had worked more than 30 years. She was careful with money. She did not waste anything. But every year, her costs rose just a little faster than her check. She told me, "Carol, I'm not living bigger. I'm just paying more to stay in the same place." That sentence has stayed with me. That is what many seniors feel. They are not asking for extravagance. They are asking not to fall behind while doing everything right. This bill also addresses long-term Social Security funding by asking higher earners to contribute more through changes to the payroll tax structure. The goal is to strengthen the system so future retirees are not facing sudden benefit cuts. That matters not only for today's seniors, it matters for children and grandchildren too. Because everyone eventually hopes the promise will still be there. The third major change is nursing home reform. This part does not always get the loudest headlines, but it may be one of the most important. Because when a family places someone in a nursing home, they are making one of the hardest decisions of their lives. No one does that lightly. A daughter does not sign those papers without guilt. A husband does not leave his wife in a care facility without going home and sitting in silence. A son does not walk away from his father's room without wondering if he made the right choice. Families need to believe their loved one is safe, but too often, that trust has been broken. For years, nursing homes across the country have faced reports of understaffing, neglect, poor sanitation, medication mistakes, and in the worst cases, abuse. And many families did not know how bad a facility was until something happened. A fall, a missed medication, bed sores, unanswered call buttons, a parent becoming withdrawn, a bruise nobody explained well. This bill strengthens accountability for nursing homes that receive Medicare or Medicaid funding. That includes stricter staffing expectations. In simple terms, facilities may be required to have enough trained caregivers available for the number of residents they serve. That matters, because care is not just a building, care is people. A resident who needs help getting to the bathroom cannot wait forever. A person who is confused at night needs someone nearby. A frail senior cannot be treated like a task on an overloaded checklist. When one exhausted aide is responsible for too many people, everyone suffers. The bill also increases penalties for serious safety violations. That means facilities that repeatedly fail residents may face stronger consequences, including the possibility of losing access to Medicare and Medicaid funding. For many nursing homes, that is a serious financial threat. And it should be, because caring for older people is not just business, it is trust. The bill also expands transparency. Nursing homes may be required to make inspection reports, staffing data, and violation histories easier for families to access. That means families may be able to see more than the clean lobby and smiling brochure. They may be able to see the record, the real record, and that can change decisions. Because choosing a facility should not feel like guessing in the dark. The fourth major change is elder financial fraud protection. This is one of the quietest and cruelest problems facing seniors. And I want to say this plainly. Scammers are not just stealing money. They are stealing peace. They are stealing confidence. They are stealing the feeling that you can answer your own phone safely. Elder fraud comes in many forms: fake Medicare calls, fake IRS threats, romance scams, investment schemes, contractors who take deposits and disappear, emails pretending to be from banks, text messages pretending to be grandchildren, and sometimes, painfully, financial exploitation by someone the senior knows: a caregiver, a relative, a person added to an account, someone trusted. That is the part families do not like discussing, but it happens. The Elder Care Protection Bill creates stronger funding and coordination for preventing and prosecuting elder financial fraud. That means more trained investigators, better reporting systems, and stronger cooperation between federal agencies, state authorities, banks, and credit unions. Financial institutions may also be expected to watch more carefully for suspicious activity involving senior accounts. A sudden large withdrawal, repeated wire transfers, a new person suddenly added to an account, unusual checks, strange patterns. These can be red flags. And now institutions may have stronger tools and responsibilities to respond. This matters because many seniors are too embarrassed to report fraud. They think people will call them foolish. They think their children will take away control. They think they should have known better. But shame is exactly what scammers count on. They want silence. They want confusion. They want fear. This bill also supports more public education, so seniors can recognize common scams before they become victims. That is powerful. Because when you know the trick, it becomes harder for the trick to work. A scammer calling with urgency loses power when you understand that urgency is part of the trap. A fake government caller loses power when you know real agencies do not demand immediate payment over the phone. A suspicious message loses power when you pause instead of reacting. And please remember this. Anytime someone pressures you to act immediately, give personal information, send money, buy gift cards, move funds, or keep the conversation secret, that is a warning sign. Do not be polite with a scammer. Hang up, close the message, call the official number yourself. The fifth major change focuses on housing and aging in place. For most older Americans, home is not just property. It is memory. It is the kitchen where birthdays happened, the hallway where children ran, the bedroom where prayers were whispered, the porch where neighbors stopped by, the yard where someone planted roses 20 years ago. So when seniors say they want to stay home, they are not being stubborn. They are trying to hold on to the life they built. But the truth is, many homes were not designed for aging bodies. Stairs become dangerous. Bathtubs become risky. Poor lighting becomes a hazard. Narrow doorways make walkers and wheelchairs difficult. Loose rugs become threats. Cabinets become hard to reach. And home modifications can cost thousands of dollars. For someone on Social Security, that may feel impossible. The Elder Care Protection Bill expands support for home modification programs. That may include grants, assistance, or low-interest loan options to help eligible seniors make homes safer. Ramps, grab bars, walk-in showers, better lighting, wider doorways, safer kitchens. These are not luxury upgrades. They are the difference between staying home and being forced into care too soon. The bill also invests in affordable senior housing designed around accessibility, healthcare access, and community connection. That last part matters more than people realize. Loneliness can be devastating in later life. I have known widows who were physically healthy but emotionally starving. Days passed with no visitors, phones stayed quiet, meals were eaten alone, and little by little, the person faded. Housing is not only about walls, it is about safety, dignity, and connection. A place where older adults can live safely and still feel part of life. The sixth major change is mental health access. This may be the section some seniors skip. Please do not skip it. Older generations were often taught to carry pain quietly. You did not talk about depression. You did not talk about anxiety. You did not say you were lonely. You did not say grief was swallowing you. You just kept going. But keeping going is not the same as being well. Many seniors carry losses that younger people cannot fully understand. The loss of a spouse, the loss of friends, the loss of work identity, the loss of physical strength, the loss of driving, the loss of a home, the loss of feeling needed. And yet, mental health care for older adults has often been hard to access through Medicare. Too few providers, too much confusion, too much cost, too much stigma. The Elder Care Protection Bill expands access to mental health services for seniors on Medicare. It aims to improve provider availability, reduce barriers, and make counseling and support more reachable. That matters, because emotional pain in later life is not weakness. It is human. And asking for help is not failure. It is survival. I think of a woman I knew after Robert and I retired. She lost her husband and told everyone she was fine. Every Sunday she smiled at church. Every grocery trip she dressed nicely. But at home she sat in the same chair for hours. One day she told me, "Carol, I don't think I'm sad. I think I'm disappearing." That broke my heart. No one should have to disappear quietly. Better mental health access can help seniors speak before the loneliness becomes too heavy. And there is more. The bill also expands attention to dental and vision care access through community health programs and federally qualified health centers. This may not sound dramatic at first, but dental and vision care can change a senior's life. A bad tooth can affect eating, sleep, infection risk, and confidence. Poor vision can increase falls, driving problems, medication mistakes, and isolation. Too many seniors have treated dental and vision care like extras because coverage was limited or costs were too high. They are not extras. They are part of staying healthy and independent. This bill does not fix every gap, but it moves support in the right direction. Now we come to the most important part. What you need to do right now, because this is where many people lose out. Not every benefit is automatic. Some may require applications. Some may require updated information with Medicare, Social Security, your state agency, or a local program. Some may have specific enrollment periods. Some may depend on income, age, disability status, location, or current coverage. So do not assume the government will simply find you and hand you everything you qualify for. That is not how these systems usually work. Start by checking your official Medicare and Social Security information. Make sure your address, phone number, and banking details are current. Review any letters carefully. Contact your local SHIP counselor. That stands for State Health Insurance Assistance Program. These counselors offer free, unbiased help for Medicare-related questions. They can help explain options, changes, and enrollment issues. You can also contact your local area agency on aging or senior services office. They may know what housing, fraud prevention, caregiver, transportation, or home modification help is available in your area. And please be careful, because scammers are already watching. Whenever a major senior benefit or law gets attention, criminals build new tricks around it. They may call and say they can help you apply. They may claim you must pay a fee. They may ask for your Medicare number. They may ask for your Social Security number. They may ask for banking information. They may say your benefits will be canceled unless you act immediately. Do not believe pressure. Legitimate government services do not demand gift cards. They do not ask for your credit card over the phone to unlock benefits. They do not threaten you with instant cancellation through a random call. And they do not need you to panic. If something feels off, stop. Hang up. Do not click. Do not answer personal questions. Call the official agency number yourself. This matters because the same bill meant to protect seniors can become the story scammers use to target them. That is the ugly truth. And that is why being informed is protection. This bill is not magic. No law fixes every problem overnight. Prescription prices may still be too high. Social Security may still feel stretched. Nursing homes may still need watching. Scammers will still keep trying. Housing will still be expensive. Mental health access will still take work, but this bill is a serious signal that the struggles of older Americans are being recognized, and recognition matters. It says the problems seniors face are not imaginary. They are not personal failures. They are not just bad luck. They are national problems that require real action. So do not treat this like another headline. Treat it like a warning and an opportunity. Find out what applies to you. Check your benefits. Ask questions. Update your records. Watch your mail. Protect your personal information. Talk to your spouse, your children, your siblings, your neighbors. Because the people who miss out are often not the people who need help least. They are the people who never heard clearly enough. And I do not want that to be you. You worked too long to miss help that was meant for you. You paid too much into these systems to be left confused by them. And you deserve to age with more safety, more dignity, and less fear. So stay alert. Stay informed, and do not let anyone rush you, confuse you, or shame you into silence. Because at this stage of life, information is not just power, it is protection.